Well, I've just read a fairly fascinating scientific paper that confirms that the virus is surviving outside the body and giving us some time spans of that. And the bottom line is, if you can't be bothered watching this video, is it's about 3 days on surfaces. So that's the bottom line. The virus lives for about 3 days on external surfaces like steel and plastic. Now, what we actually did on this video was, I think it was late January, early February. We wondered about this question: can the virus survive outside the body? And the only studies I could find then were done on the Sars coronavirus type 1 that caused the 2002-2003 outbreak. And we did find out from that, and from studies of analog viruses that people had done around about that time, that it was we found out that the analog viruses for the SARS-1 could definitely survive outside the body. And from that we inferred that the SARS coronavirus 2 that's causing this COVID-19 pandemic could probably survive outside the body as well, and we've been working on that assumption ever since, and it turns out it's just as well that we did. So let's look at this in a little more detail now. This is the study here, and obviously I'll post this for you to peruse it yourself in case I've misunderstood everything. Now, aerosol and surface stability of SARS coronavirus 2. Now, this SARS coronavirus 2, this is the virus that's causing the COVID-19 pandemic at the moment. Severe acute respiratory syndrome, coronavirus type 2. And the type 1, the severe acute respiratory syndrome coronavirus type 1, that was the one that caused the 2002-2003 pandemic. So this is our current COVID virus. And this paper was studied in the New England Journal of Medicine, so published in a very prestigious medical journal, at 17th of March, so it's fairly new data. And it was examining the stability of the SARS coronavirus 2, that's our current pandemic virus. And it was also studying the survival of the coronavirus type 1 and comparing them. And it was looking at aerosols. Now, the aerosol particles that they were looking at, that they put the virus into, these two viruses into, were 5 micrometers size aerosols, and they were artificially generated by an aerosolization machine. Now, this is a reasonable size to choose, because normally when someone breathes, coughs or sneezes, the droplets of moisture in the air that you are coughing out or sneezing out are 0.6 of a micrometer down to all the way up to 1,000 micrometers, and 1,000 micrometers is 1 millimeter. So it's not an unreasonable size to pick, and it's a reasonably good biological analog, in other words. Now, the temperatures that this study was done at, all the temperatures were moderate temperatures, 21 to 23 degrees centigrade. So all the experimental conditions were kept between 21 and 23 degrees centigrade, which is 70 to 73 degrees Fahrenheit. The humidity was kept at 40%, and the study carried on for 7 days. So quite reasonable temperatures. Now, this paper did not study what happens with colder conditions or with warmer conditions. But from the work that we looked at before on the SARS coronavirus type 1 from 2002-2003, what was found with that is that colder conditions the virus would survive for longer. So I would assume that it's the same with the coronavirus type 2 causing the COVID-19. That at colder temperatures the virus would survive for longer than the figures we're going to discuss. Likewise, at significantly warmer temperatures, I would surmise the virus would survive for less time. So this is moderate temperatures, moderate humidity. If you live in a colder place, then it's going to live for longer than that, I am sure. In a warmer place, you've got a bit of temperature on your side. It won't live for as long. But unfortunately, we now believe that this virus is spreading rapidly, even in tropical countries. So it's not going to be a huge limiting factor, unfortunately, as we hoped it would be. Now, the SARS coronavirus 2, that's the one that causes the COVID-19, the one we're currently suffering from, remained viable in an aerosol for at least 3 hours. Now, this is very significant because You get some infections that are droplets that survive in big droplets like this. So, you have to have quite a large droplet. Then you have your viral particles in there. And these large droplets. I mean, sometimes you might, if you've been working at your computer and you sneeze and you don't put your hand on your mouth, you can see big droplets on the computer screen. We don't advise that these days because they can be up to a millimetre in diameter, as we see from here. So you get big droplets like that. And you also get smaller droplets, which are more aerosolized droplets like that. Now, the difference is that these bigger droplets will tend to fall to the ground fairly quickly, whereas these smaller aerosolized droplets will tend to stay in the air for longer and can be suspended in the air. So some diseases are described as being aerosolized and some as droplet. And it looks like this COVID-19 is kind of in between those two. So it's partly aerosolized, not fully aerosolized. It's not going to blow from house to house or anything like that, or from village to village. But it means it can stay in the air, and it looks like it can stay in the air for up to 3 hours. Now, the implications of this are immense. Stuffy, crowded areas, the virus can probably be suspended in the air for up to 3 hours. This is why we have to practice social distancing, physical distancing, why we need plenty of fresh air, why we need the 2 metre gap between people, that's 6 feet, but also why it's so important to avoid crowded places, because the virus can be around in the air, hanging around in the air for a period of time. And this probably partly explains the rapid international spread we have seen on this virus, for example, in aircraft, where you've got relatively limited circulation of air and people in a fairly confined, well, a very confined space. So quite a lot of implications there for not being in poorly ventilated areas with other people at the moment. Now, the specific results here. Now, what they did was, in plastic and stainless steel, they covered the half-life. And the half-life on plastic of the coronavirus type that causes the COVID-19 was 6.8 hours. Now, what does this mean? Well, this means like if there was 1 billion viral particles in a droplet when someone first coughed it onto the surface, then in 6.8 hours time that will go down to 500 million particles. Then another 6.8 hours later, so that's like almost 14 hours later, this would be down to 250 million particles. So it's dropping off really quite quickly. These viruses are dying off quite quickly, exponentially. They're dying off quickly, logarithmically. The numbers are reducing dramatically and quickly. But there was enough viruses after 72 hours to still cause infection. So even though the viral numbers had dropped off quite dramatically, infection could still be caused after 72 hours. So how long is the virus infectious for on plastic surfaces? The answer is outside direct sunlight at these temperatures and this humidity, 72 hours. Long time. Stainless steel, the results were similar. On stainless steel surfaces, the half-life was only 5.6 hours. But again, despite the lower half-life, still possibilities of infection up to 72 hours after someone had coughed or sneezed on a surface. And the implications of this, of course, are huge for all public surfaces. Counters in shops, counters in post offices, pin machines, contactless displays in supermarkets, any public surface that you touch made of plastic, then it can survive for 72 hours. This is a classic. This is plastic here. So when I'm talking here, breathing out, coughing on my phone, 72 hours later, you pick it up, someone else picks it up, it could still be infectious. Great implications of that. 72 hours. That's why we always have to be cleaning these things with antiseptic wipes. I'm cleaning mine now as often as I clean my hands. Now, and that's quite often. Stainless steel, 72 hours. Right, cardboard. Now, the half-life figures for cardboard weren't quoted, but the virus was surviving for 24 hours and still infectious doses of virus on cardboard surfaces. Copper was much less. but still viable for 4 hours. So even though copper surfaces are very unfriendly to the virus, it wasn't eradicating the virus straight away, and it would still be possible 3 or 4 hours later, if someone had sneezed on a copper surface, if I touched that surface, that I could become contaminated. So copper is not killing it as quickly as we had hoped. Now, the stability of the SARS coronavirus 2 that's causing the current COVID and the SARS coronavirus 1 that caused the 2002-2003 outbreak were found to be fairly similar. And this isn't surprising because they're both coronaviruses. Severe acute respiratory syndrome, coronavirus type 2, causing the COVID that we now have. Severe acute respiratory syndrome, coronavirus type 1, that caused the previous outbreak. And of course, this virus no longer exists in the world. It's been, well, obviously it exists in experimental labs, but it doesn't exist. It's not causing infection now. It's all this one. So the epidemiological characteristics that differentiated these two are interesting. So why have we got a pandemic with this one, but this one was able to be controlled? Well, again, this study about the aerosolization and survival on surfaces tells us a lot about that. So the epidemiological characteristics, high viral loads in the upper respiratory tract in this one. So what this means is we know this virus is essentially a virus of the lower respiratory tract, but in SARS coronavirus 2 that causes COVID, a lot of that virus goes up into the upper respiratory tract. And what happens when you cough is the sputum goes from your trachea through your vocal cords into the back of your mouth, where you can contain it, obviously. And it goes into it goes from the upper airway into the back of your mouth and breathed out through the upper airway. So, and also, of course, infectious in sputum. So this has got more viral load in the upper airway, and that means that more of the virus is shed. So more of the virus comes out from an infected person compared to the SARS coronavirus 1. And the other big difference here is that with SARS coronavirus 2 causing the COVID, people A means without, asymptomatic people. So people that are feeling fine can still spread the virus, whereas this virus was shed mostly by people that felt very ill. So there wasn't barely any shedding at all of this virus before there was quite serious clinical features. Whereas here, someone can be waltzing around feeling fine and shedding very large amounts of the virus because it can give out high viral loads in asymptomatic and pre-symptomatic people. And we believe that people can have quite high viral loads, enough to infect other people for 48 hours probably, before they get symptoms themselves. So this explains quite a few things. The aerosol and fomite transmission of SARS coronavirus 2 is therefore plausible. So these are scientists, they're not saying it's definite, they're saying it's plausible. The science backs up what we've been thinking about for so long. Now, this raises the possibility of nosocomial spread. Now, nosocomial means healthcare-acquired infection, healthcare-acquired infections in hospitals or between nurses and doctors and patients. And this becomes possible. So a patient could be infected with the virus, cough on a clinical surface, and the virus still viable 3 days, 72 hours later. So quite a long time. Implications as well for things like doctors' pens, medical instruments, other things like that. And this could also explain super spreader events. Now, super spreaders are the minority of people that can infect the majority of the next group of people to become infected. Super spreaders basically go around infecting people who weren't previously infected. So why is this? Well, probably because there's high viral loads in the upper respiratory tract. Therefore, it can spread from person to person by droplet and by aerosolization in poorly ventilated environments. The virus can probably hang in the air for up to 3 hours. And also, we now know that these super spreaders can be coughing out very high viral loads, or even just breathing out very high viral loads that go onto surfaces, are touched by me, and I contaminate myself with it as an uninfected person. So it explains quite a lot. This actually explains quite a lot of why the spread of this virus has just been so fast. faster than virtually anyone anticipated. Because high viral loads, asymptomatic, pre-symptomatic shedding, aerosolization, droplet infection, and survival of the virus on surfaces is plausible. So it does explain quite a lot of the spread. But what it does mean is we've sort of made the right assumptions, at least on these videos, for the last couple of months now, as regards spread. And doesn't it just really highlight the importance of hand washing? The virus that's surviving on these surfaces for up to 72 hours, and you don't want to get it into your face. Good hygiene, cleaning surfaces, hand hygiene. We now have a very good scientific rationale for why this is so important.